Hey friends, Kat here at FreeBody Clinic in Asheville, and in this video I'm offering you today, I'm going to show you some real specific releases for the Erector Spinae bundles that run along the spine. So as you know, the Erector Spinaes are those ropey muscles that live along the spine and a little wider out along the ribs, on the ribs, and they hold the spine erect, they lift folks up. These muscles get really stuck with a lot of tension because we tend to round and slouch, most folks. So they'll get really kind of thin and sticky. Here's one thing to keep in mind also, because the erector spinae attach along the top rims of the pelvis, when one hip is higher than the other, you'll often notice that areas of the erectors on one side are going to be real thick and bundly, where they're kind of flatter on the other. And you might think, why are they so different from side to side? Most of the time it's because one hip sits higher than the other. So with one hip higher than the other, those erector bundles are going to be shorter, fatter, thicker, and stronger than the other side. So I'm going to show you some nice warm-up to do to get them ready, get them hydrated, because they get real dry when people are slouched forward. Then I'm going to show you some real specific techniques with using your elbows to release those erectors. You want to use that technique very specifically in those places where it's real thick and bundly. They're going to have more tenderness through there anyway. And then what I've also included, we have two videos side by side where you're also able to see my body mechanics, because I'm a stickler for body mechanics. I want you to use your body well. So through periods of this video, you'll see side by side videos to help you with your body mechanics. So get psyched. Erector Spinae releases up next. So erector spinae treatment. When we are working with someone when we want to work through the erectors, it could take a long time to really fully treat iliocostalis, longissimus, spinalis. And the way I remember those muscles is that it's like I like my spine. So iliocostalis, longissimus, spinalis is right next to the spine. And this is a very common pattern that I see, is that one side of the erectors is much thicker. There's a lot more like that's the technical term, I think. As you're going over, this side is bundlier, also technical, because her right hip sits a little bit higher. So we're definitely going to have to do some quadratus lumborum treatment for this, for sure. But then, once we do that release in that QL to soften that pull of the hip, and it might be, maybe she stands on her right leg more than the left. So if she's standing over to the right, if she stands over to the right more than the left, then that right hip sits higher, that QL on the right side gets shorter and tighter. So what we're going to do, and this is a technique that you can use through wherever you need in the erectors, and it's a 1-2-3 technique. I call it the 1-2-3 technique for the erectors. And we know that the most prominent really is the sort of longissimus bundle of the erectors. And what we're going to do is weave an elbow between that erector bundle and the spine. So we go between that thick erector bundle of the spine and angle the elbow out laterally. And then we come over the edge, we hook the other edge of the erector bundle and we angle in medially. And then I usually use my hand to support my elbow, because if I'm riding that tube of the erectors and it's very bundly, it's going to be wiggly, and anchoring with my other hand is going to be very useful to me. And then it's just 1-2-3, and then we move down a little bit. We go 1, we get in there, and we angle straight down to the spine, slightly outward, straight down to the floor and slightly lateral. And then we come to the other side of that bundle. We angle straight down to the floor and slightly medial, and then we get right on top of that erector bundle. Now,
with trigger point work, you can hold each point where it feels really tender for up to 1.5 minutes. So if you think about it, if I'm doing a 5-inch section of her erectors and I'm doing 1, 2, 3, if each one of those 1, 2, 3s takes me 4 minutes, I'm going to be here all day working on her erectors. So I don't do this technique through the whole bundle. I do it where it's most prominent, and that's the most effective way, because I want to give time for those spots to soften. She's not going to have tension and tenderness in each one of these spots, but I want to feel, because they're ropes and it's round, her erectors might be holding the trigger point more medially, maybe more laterally, maybe it feels good to go just straight down on it, because maybe the point, there's also some rotatores or multifidi, any of those deeper rotator muscles might be involved, and we might also be catching some of that too. But we know that this section of her erectors is thicker, and I'm sure you felt that in your clients. I'm sure you felt going along and like, oh wow, this is really roly-poly. And of course I can palpate, but you can even see those erector bundles flatten more under my fingers. This doesn't, it just goes and so that's where I'm gonna pick to do my 1, 2, 3. All the other parts of the erectors are going to soften just by my doing all of that long, slow, deep stripping, sinking, warming up. Anything that's really stuck in trigger points and tension, and it might be just positional over time. Her posture might have created this situation, most common. But all of her erector bundles don't need that treatment. Just the section here where she is experiencing, where we're finding it more bundly. Okay, so we're gonna get to work on that bundle. So just letting her muscles know that I'm coming. Here I come. I'm going to give you some particular attention right through this area. The earliest trigger point therapy training I did was with the Bonnie Pruden folks, and they say all you need is 7 seconds per trigger point. And if I'm in a hurry, and which just means that I have 483 trigger points to do on this person, I am going to maybe only hold them 7, 10, 20 seconds each. I may not give this quite the same amount of time as I would somewhere else, just because it's going to take so much time to get through this section of tissue. And what I have found over the years is that I can do that 7, 10 seconds, 15 seconds, whatever. We're training the nervous system that when I press, you let go. And just a little note, you could always, keep your client cozy, right? It doesn't, you're here to serve them. So you might, if they look like they're getting cold or whatever, I know that Erin burns a little hot, so she probably doesn't need that, but I just wanted to let you know, that's a really nice thing to do. They feel cared for. And when someone feels cared for and thought of, they relax more, they trust you more. Their nervous system, their tension, their trigger points are going to let go faster because they trust you. So just something little like that. Oh, here, let me tuck you in. Okay, is that okay? Does that feel good? Sometimes you'll see someone's getting little goosebumps. So I'm going to ask you, Erin, do you like that up there, or do you want it open?
It really doesn't matter.
It doesn't matter.
Yeah.
Yeah. She's nice and warm. All right. So I like to start at the top and work my way down. And I love to use my elbows for this work because I always love to just have my thumbs saved as much as possible. Because in trigger point work, some places you just have to pinch, right? You just have to use the thumbs and the fingers, and you can't always use your elbows. So in this scenario, I'm going to use my elbow. And I'm going to start right up here, and I'm going to do this 1, 2, 3 technique, and I'm going to do it through this section of her erectors. So I'm going to start right up here where I can see that and feel that it's thicker. I'm going to lay my right elbow in, and I'm going to put my finger on her spine. I don't want to put my elbow on her spine. That would be terrible. So I'm going to put my finger on her spine. I'm going to lay my elbow in right next to it, just lateral to it. See if I can wedge my elbow point in between her spine and that line of tissue. And then because I want the pressure going laterally, I'm going to shift my shoulder forward of my elbow. And then that's going to sink back. And how's that spot right there, Erin? Does that pressure feel right for you? You can always say more or less at any time, just so you know. And then, Erin, I'm going to let you take a couple breaths here, and I want you to let me know just when it starts to feel a little easier. And then my other hand is just always doing something nice. Feels a little easier. Great. That's just what we need. We just need that tension to start unraveling. So now I go right, I lift off, I go just beyond that thickness, that ropiness. Slide my elbow in, and then I lean my body in medially. And when I want a little more pressure, all I have to do is lift my hand. And I'm going down toward the floor in a little angle medial. And this is iliocostalis line. How's that feel, Erin? Do you want more or less pressure?
That's perfect.
And she said it's perfect. And why is it perfect? It's perfect because I'm not pushing. It's perfect because I'm sinking my body. I'm not trying to crack her ribs or anything like that. I'm not trying to push. I just sink. And what's beautiful about using your elbow is that if she said she wanted less pressure, all I have to do is open my elbow. It takes that elbow point out of the tissue. If she wants more, I just bend and it drives it right in. And she's taking some nice deep breaths. And also, Erin, let me know, please, when that feels a little better. And it feels better. Wonderful. So now we're going to drive right into that middle point. Notice I just moved my hand right in there to get ready. We've got that thickness of that erector bundle. I'm going to lay my elbow in open so that I can close the elbow, lift my hand when I want more pressure. I'm stabilizing my elbow with that hand. And then I lift the hand. And she's going to let me know when it's just right. Perfect right there. See, I'm not working. I'm truly not working hard at all. My spine is long. My head is long. I'm not hanging my head. I don't have to look down at her the whole time. I can look forward. I'm using the point of my elbow, and it's fairly effortless. I don't have to push. Ooh, nice. That feels like it softened a whole bunch. Does that feel better?
Yes.
Great. Awesome. So that feels better. So you can see the red marks. That's where I just was. And it is a little flatter right there. So now I'm going to go down just about an inch or so, right? I'm just going to go down about an inch. I'm going to do the same thing. I'm going to get right next to the spine, put my finger on the spine. I'm going to put my elbow right next to it, just lateral. I'm going to sink that elbow in. My other hand is doing something nice. It's just anchoring here and might anchor down on the hamstrings. That feels really nice also. And then I bring my shoulder forward and it's going to drive my elbow point backward and I sink down toward the floor. And I'm just sinking. And her body stopped me. If I went deeper, I would have to push. So Erin, how's that pressure? Perfect. Right? Because I'm not pushing at all. Please don't push into your clients. Their tissue pushes back. It doesn't like it. Right? You don't like to be pushed around. Your muscles don't like to be pushed around either. So you just sink. My back is long. Now I just check. I'm holding. I'm waiting for her to let me know when it feels softer or easier. Feels good. Feeling better. Great. Awesome. So now I'm going to lift off. I'm going to slide over that bundle. I come right to the outside. Iliocostalis is a little flatter, a little wider out on the ribs. And I'm going to sink straight down. And I'm beyond that ropiness of longissimus. And I angle in medially. You okay? Yeah. How's that pressure? Perfect pressure again. Good. I'm just crushing it over here. Totally crushing it. And my hands are here. She's not wondering where my other hand is because it's just right here. My arms are here. I could again put a hand on the hamstrings because the hamstrings actually have a lot to do with back pain, as we discussed in the anatomy section. Ooh, nice. I can feel things changing. I can feel some of that tissue opening and softening. That's great. All right. So now I'm going to go in. I'm going to do that straight down. Okay, so this is where I started this way. This was the second point. And now here's that ropiness. I don't want to just jump right in there. We're going to flank it on either side. And then we're going to go straight down. So because it's ropey, I just like to give my elbow a little support there, wrap my other hand around it, start with a flat elbow. I sink down, just lean my body in, sink down. And then when I want to start driving pressure, I just lift my elbow. Erin, let me know. Right there. Mm-hmm. And see, because I'm moving slowly, I'm just sinking, and I'm moving slowly, her body has time to feel what I'm doing. Her body has time to let me know, and she has time to let me know. Okay, that's good, right there, perfect, just right, because that's what we're going for, just right. And people know I don't use numbers. I'm not give me a 7, whatever. It's so arbitrary, the 7, the number system to me is so arbitrary. Softer, great. Right. So now we've done a few trigger points. We want to do a little soothing because trigger points are intense. And they can bring a little fight or flight into the nervous system. Like, whoa, hey, that's my tender spot. What are you doing? Right? So we just kind of soothe along there. So good. And now we're going to come down again. And we're going to get on that inside, outside, and straight down. We're going to do maybe 2 or 3 more. Okay. So I find the spine, get the elbow in, kind of sink my elbow into that spot. Just that feels good, right? And sink in, kind of angle my shoulder a little forward, and I sink down. I don't really feel like I need to lift my hand. How's that pressure? Okay. You can always say less or more. Some of them take a little longer, yeah. And truly, we could be here for 2 minutes, a minute and a half, or 2 minutes, and sometimes it doesn't ever soften. It just means that other parts of the body need to release first before it can let go. But there it goes. I feel that now. It just I'll soften a little more, yeah? Great. So we're going to come out of that spot. Elbow is right in there. Now I'm going to come off, and I'm going to come out to this side. Now my shoulder is behind my elbow. And then we're going to go right straight down. And slowly sinking. Great. And you'll notice my shoulder is directly over my elbow. Directly over the elbow.
Hey, quick pause in this video. Kat Matlock here at FreeBody. I'm so glad you're here. And I just want to point out a couple of things. Down in the description of this video is a link to my online classes for continuing education credits. I'm nationally certified NCBTMB, so most states will accept those classes as continuing education. Also, go ahead and subscribe and like this video. Put a comment down if you learned anything from this video, or if you have a question about any of the information. I do look at comments and I do answer questions.
Soften. Great. I'm just gonna take a little break. Oh yeah. Let me just check. How's all that feeling?
With me?
Yeah. Well, under my hands, but also with you, Erin.
Yeah.
How does that feel? Can you feel a difference?
Oh yeah. Oh my gosh, yes.
Yeah, she's saying, oh my gosh, yes, such a difference. Awesome. And I can feel those ropes are not as sticky. They're not as stuck as they were before. Now, often with people with scoliosis, if they have a real curvature, one side's going to be lifted and really intensely thick maybe here, and then the opposite side up here, and that's because of that correction, the body trying to correct. You know, the body wants to be straight up and down, and if there's like a little detour down low, there's going to be a detour on the other side up high, trying to bring everything back to center. That feels so much better, so much smoother. Those erectors are so much better. I feel like there's like one more right there that I want to, and so I can just start using my thumbs like, oh, how's that feeling? I can get a little more specific with those lines. It actually feels really good. It actually feels really good. Awesome. So when you're releasing the erector bundles, just finding a section where it's particularly bundly. Again, anatomy. That when it's particularly bundly and just kind of really prominent and it's not giving under your fingers, that's the area where you want to use that 1, 2, 3 technique. 1, 2, 3, 1, 2, 3, 1, 2, 3. To just help that whole section to tone down, to release some of that tension. And then you're also going to want to talk to your client about, well, what's going on here? Are you standing, for my client here, Erin, is she standing with her weight on the right? Is that QL really stuck? Maybe also inner thighs. When someone stands with their weight on one side, those inner thighs are going to be stuck short also on that side. So that's going to keep, even when she goes to stand on 2 feet strong, she's still going to have that pull to the right. And that's going to create that shortening through the erectors chronically on the right side. So we want to treat it. And then we also want to encourage her to check her posture. Maybe notice if she has that tendency to stand on the right leg. And she'll spend the rest of her life trying not to stand on that right leg. And that's just about how long it takes, because those postural habits are deeply embedded. And we also might take it further, and if that right QL is short, the right gluteus medius and minimus, or the left gluteus medius and minimus, is going to be a little short. It's going to feel really good for her to have some compression along that top rim of the pelvis, really both sides. She's going to feel QL pain there on that top rim of the pelvis. But the left glutes are going to be short, because as the pelvis tilts up to the right, it drops down to the left. So that would feel really good to her to have that compression right there.
Yes, it does.
She confirmed. Awesome. So the last thing I want to do in these erector bundles, as we just keep gliding down and along, one thing to notice is that the spinalis lives right real close to the spine. So we're going to do a couple more things in this treatment. We're going to check through spinalis really close to the spine and see where that's acting up. And we're also going to work, one of the most common trigger points in the body is an iliocostalis point right outside the shoulder blade. So we're going to treat those as well. So one of the most common complaints I get, and most common points in the body, is right here at this right medial to the shoulder blade, iliocostalis. And what's really fascinating to me is that it almost always shows up in the left side of the body more than the right. And so I have some theories about it, because more people are right-handed than left, and we use the two sides of our bodies very differently. I just think that it just has to do with the way that we use the left side of the body as opposed to the right side of the body. So as we come up and palpate along that medial scapula area, and we're off the scapula, I'm not on the shoulder blade at all right now. And I find this little line. And so we can almost even see the trapezius coming up there. And the trapezius just moves pretty much right out of the way. But then we've got deep to that, this section of iliocostalis. And we can follow it down. Notice, see how wide that is? Like iliocostalis is wider than you might think. And so we could kind of strum along there, glide down. The easiest place to locate that is right near the shoulder blade. Here's my inferior angle of the scapula. And I ride up along, and rhomboids begin about 1/3 of the way up and then angle like a chevron toward the spine. And so right near that inferior angle, as I can put my flat thumbs and start to drag across. And I'm going to run over a speed bump. And that speed bump there, this is iliocostalis tissue. This is one of those erector bundles. And usually along this area, there's a real tender spot. So I'm just going to check in with my client. I can follow that all the way up. See that clunk clunk that happened? That's rhomboids. That's when, because I'm getting through many different layers. By the time I get up here, what have we got up here? We got erectors, we got rhomboids, we got trapezius. So there's several different lines of tissue. So I want to stay a little bit down lower by the inferior angle. And it's usually pretty close in. So I can feel this line of tissue right here. So I'm going to get real specific. And I'm going to turn my thumbs down. I'm going to bring this table down a little bit so I can take care of my body a little bit better. And I'm just going to palpate. I'm going to just check and see. Erin, is there a tender spot there?
A little bit.
And there may not be. Yep, that's fine. So I'm just going to keep walking up.
There is one. I felt it, but...
Mm-hmm. Up a little higher. Ooh, that's going to be a good spot, I think. Or it's just thick. Like sometimes places where I might think there's going to be, it's just because layers of tissue are there, right? So we can't always feel it. And so I'm coming up a little higher.
That's pretty sensitive.
And that's sensitive. That's a tender spot right there. So, and how is that pressure? Do you want more or less?
You do a little bit more.
A little bit more. So a little bit more means that I'm just going to stand over and I'm going to sink my body weight in a little bit more. Whoop. And that got real exciting. That got real exciting after that moment. And then, Erin, I'd just like you to let me know when that feels a little easier, a little bit better. I'm just using a supported thumb. Just one thumb right there. See how close I am to the shoulder blade? It's almost always where that little point lives.
Starting to get a little easier.
Starting to get a little easier. We'll just encourage her to take a nice deep breath. Oh, great. And then we're going to back out. It's just a really common spot right there near that intersection of the shoulder blade. And so I just want to check through that tissue. Here I can find another little rope right here. And that's more longissimus. If I come out a little wider, here's iliocostalis. So here I'm just in ribs. It's really the flat of latissimus actually covering up this area. There's no ropes going up and down. The first rope I bump into is iliocostalis. The second rope, where I usually do my 1, 2, 3, that's longissimus. And then up through the central area here, little tiny thin rope is spinalis. I just want to use my elbow a little bit more. This tissue is very thin. So, you know, often when someone says to me they want deep work, what I say is what you want is specific work. You want to feel it, and I get that. But some tissue is really superficial. It doesn't need to be deep. It just needs to be specific. And so I'm just going to slowly drag my elbow point along here. And Erin, I'd like you to let me know if there's any place along here you want me to stop.
Right there.
I'm going to sink in a little bit. And that's often a good way to explore, because especially early in your massage career, it will be difficult to feel the difference between like going over a rib, going over bundles of tissue that are layered with other tissues, and actually feeling where a trigger point is. And as I've mentioned before, we can't always feel it. We just can't always feel it.
Feels very loose.
Feels loose, great. And then I'm just going to continue to glide down. We've got just a little bit longer, a little bit further in that iliocostalis. And again, if she wanted more pressure, which she didn't ask for, so I'm not going to do it, but if she wanted more, I would just bend my elbow more. I'd just bring my hand closer to my shoulder, and that would drive my elbow point into that tissue. And then I just do some nice soothing with my other hand. Great. And that's our iliocostalis. And I just want to check and see if she has this point on this side. And drag my thumbs across. I kind of lay down. I'm lower than the scapula, that inferior angle. I'm going to slide across. And that first kind of ropiness is iliocostalis. I'm going to follow that up. It often just gets real kind of thick and sticky right around this area. And here it got even a little chunky. How about right there? I'm going to lay my elbow in. You can let me know if I'm in a good spot, okay? I'm going to lay my elbow down. I'm going to lean my body weight into it. Good spot, yeah. And it's just usually about an inch or so up, and of course everyone's anatomy is different, along that vertebral border of the scapula. And up from the inferior angle of the scapula. Nice. Take a nice big breath in your belly, Erin. Belly gets really big. And then as you exhale, just sinking your whole body down into the earth. Nice. Great. Catch up there, yep. And I can see your right shoulder sits a bit higher. And so it looks like that it's, and you can probably see in the camera that the right shoulder is just a little bit closer to her ear than the left one. So that catch is probably more about levator scapula than it is about an erector. But let's see, let's just give a little glide. Because it is erectors all the way up. So as I kind of wiggle across, as I bump right next to that shoulder blade, how's that? Really good. So this is such a good point about everything is relative to everything else. Nothing works in a vacuum in life or in your body. So one muscle shifting its tensional balance is going to affect other muscles and the other muscles. And so now that we've been releasing through her erectors, some of the other tissues are going, hey, what about me, right? And so really the best massage, the best treatment you can give is that you follow the tension and you listen to your client. And you ask them, sometimes I'll ask, like, or I'll follow it. Oh, if I feel like I want to work up here. Oh, I feel like this. When my client says, oh, there's something now up here, I'm going to go, okay, let me put my elbow in that, see what we can do, right? And so I'm going to kind of wiggle along here. And just because I know, yep. And I'm going to sink right in. And I'm closer into spinalis, or this could be trapezius. And because I'm using my elbow, I don't have the same sensitivity as my fingers. I can't really tell what layer of tissue I'm in, but I could feel that it was thick. And that thickness can indicate that there's a trigger point there. And so notice the open elbow. I didn't have to bring my hand up toward my shoulder much. The angle is good here. I'm 90 degrees to the tissue. And it's just starting to soften. And we'll just let her take another breath or so here. Beautiful. And then before I drag anymore, I want to soften my pressure. I either want to lift my body up out of it, or I want to drop my hand so that my elbow point is not dragging into that tissue anymore, right? I don't want to drag with a ton of pressure in that tissue. Because the thing is, the whole line of the erectors, any of those erector bundles, is not going to need the full attention. And we just follow along. We follow our clients' bodies. We palpate, we feel in. Spinalis is really close to the spine here. It feels like right here on this left side now, it's a little bit stickier. So I'm just going to place a thumb. Here's the spine right here. I'm going to place a thumb, straight arm, and I'm going to sink my body weight in. And how about there, Erin? Is there something tender there?
Oh, yeah.
She said, oh, yeah. And what did I feel? I just felt that it was thick. And it was thicker relative to the opposite side. I had my two thumbs going along here. I could feel this left side was thicker there than the right. And this is the area of spinalis. She said it's a hot spot on that side sometimes. And that makes sense. Especially because, you know, one of the things we talked about was that as this lower section of the erectors on the right side is a little wonky, the upper left side will often kind of counter to try to counterbalance. And you know, now we're up in this upper thorax. We're starting to get into semispinalis. And you know, these posterior cervical semispinalis splenius muscles, they're all erector muscles. They're all erectors. And then we just drag. And we don't want to glide with our strongest pressure. And then we just do something a little nice every once in a while, a little soothing, like, whoo, good job, that was great. So iliocostalis, longissimus, spinalis, those three lines of the erectors. So many different places where they can get stuck and sticky. And the tension in those muscles, the trigger points, their pain referrals, especially from about shoulder blades down, they tend to refer down. And even this one up here by that medial scapula often just refers down. That one can refer all the way down. It can feel like a line of tension, a line of aching all the way down. These middle lower thorax points can refer even as far down as right next to the sacrum at the SI joint, or even into the low back. And then I always finish a little treatment of those erectors with some nice soothing, just like I began. Just as I began, I'm going to get some oil, I'm going to get it on the body, I'm going to glide. All right. Mm-hmm. Great. And that is treating iliocostalis and just doing some awesome back work.